The other type of disasters produced by extreme weather events, of course, are floods. Here is a list of world's top 10 floods associated with the highest mortality for the same period we've been looking at, 1900 to 2013. Here, 1999 is the last biggest one, and the ones after that have more recent ones after that haven't ranked in the top 10. So sadly, again, China shows up. As we saw, China and India are suffering droughts and floods consistently over millennia just because of their reliance on monsoon, which has these vagaries or vicissitudes as they're called each year. And you also have countries like Guatemala, Venezuela, and of course Bangladesh, which is sitting almost at sea level and is facing unique hazards in terms of sea level rise, cyclones, and sinking land, and so on and so forth. So goes from let's see, 1931 to 1959, 39, 35, and so on, with deaths ranging from 3,700,000 to 28,700. So remember, floods rank second in terms of casualties. Droughts tops the list of deaths, as we already saw, especially when you consider morbidities and the number of people affected. What are the public health impacts of flooding? These, according to the Center for Disease Control in the US, include damage to homes and consequent displacement of occupants, infectious diseases exacerbated by crowded living conditions. When there is flooding, people crowd into shelters or into families together in a house, and of course compromised personal hygiene. Even after recovery, floods can leave mold and other things that can persist for a long time unless they're properly taken care of. Contamination of water sources, it's always a big concern when floods happen. Disruption of sewage service and solid waste collection. For weeks, neighborhoods may get stuck with water that doesn't drain away, or homes that have to be cleaned up, dried out, disinfected, fumigated, and so on. Increased vector population. Water loves mosquitoes love water, standing water, and vector populations will increase. There are also other vectors like mice that get displaced, and human contact may increase. Plague, remember, is still around, so that's always a concern. Injuries sustained during cleanup, so that's something that is not to be forgotten, especially with water, standing water, people wading through, not knowing where they're stepping into, or fallen power lines, and so on. Stress-related mental health, again, behavioral problems and mental health are a big negative health outcomes during extreme weather-related disasters. Substance abuse problems, and of course death. Okay, this is not a comprehensive list, but gives you a good sense of the range of issues that people face. Now, if we rank the top 10 largest floods by the number of people affected, the last year we get here is 2010. The years after that, where there have been floods, at least at the time that this report was written, do not come into the list, but I'm sure this list will be updated one of these days. Bad news again, China. Except for 1 year, China dominates this list. Of course, China's population problem is part of this list, in the sense that same amount of rain would cause a larger number of people to be affected because of the population density. So you're going here again, 98. Depends on what time of the year 1998, because 97, 98 was an El Nino. That El Nino ended by May. By July of 1998, there was a very strong La Nina, which is likely to have brought massive amounts of floods or rain to China. And if it was coming out of a drier than normal year, then it's likely that floods could be exacerbated because of vegetation changes, soil characteristic changes, and so on. 91, 96 was a mild La Nina, 2003, 2010. So nothing special about the other years. 1989 was, the rest of them were fairly normal. 99 was a La Nina, but you can see that the number of people affected is staggering. It's 238,973,000 at the top here, and 100 million with and 10,000 people on the last one here in 1989. So these are really, really large number of people affected, and if you consider these health outcomes, especially contamination of water resources and stress-related mental health and so on, as centrally controlled and efficient as the Chinese government may be in disaster reduction, managing so many people who may be displaced and affected in health and resources and food and so on is not going to be easy. Okay. Storms, world's top 10 storms, tropical cyclones associated with highest mortality. 2008 is the last one here, but we know that the mortality with cyclones has reduced even in a country like India. Forecasts have gotten better. Disaster management and disaster recovery have gotten supremely better. But in this list, you still have the Indian Ocean Rim countries and China. So you have Bangladesh was massive, 300,000 losses in 1970, but you can see here in 1965 it was 36,000. In 1942 it was 61,000, 1935 60,000, and so on. So India here 1942 40,000, but this in 2020 2021, for example, the number of deaths are in a few tens. So the evacuation plans, etc., response to early warnings and so on have become very good, whereas poorer countries with no such infrastructure like Myanmar and Bangladesh still pay a heavy price. So as late as 2008, Myanmar had 138,366 deaths here. Okay, so the convective storms in Europe over 1980 to 2014 show an increase here over this period, with lots of flash floods, tornadoes, hailstorms, and severe storms. Okay, so you can see in 2014 there was a massive increase in the number of severe storms and flash floods compared to 1980. So you can imagine that this is a serious concern now in terms of warming. Of course, for Munich Re, it's a concern about insurance payouts. Nonetheless, countries like UK, Germany, France, Norway, Sweden, everybody is making good preparations for the changes in convective storms. Okay, landslides, let me just include that here. World's top 10 landslides associated with highest mortality. Again, 2010 is the last one here in China. We are having one in Japan right now, as I also mentioned. Venezuela, Soviet Union, Peru, Honduras, Italy, China, Philippines, India, Colombia, Peru, China. So you can imagine that these are mostly not the richest of the countries. So there is a relation between amount of rain, landslides, infrastructure, governance, safety of the buildings, and so on and so forth. But you can see that the number of killed here goes from 30,000 down to 500. Okay, so that gives you a broad sense of the kind of disasters that extreme weathers trigger, and the mortalities involved and the health impacts involved. Then we have to look at the risk that comes with these extreme weather events and the associated disasters, and how we measure risk and how we reduce risk, or how we combine risk reduction with other goals of climate adaptation and mitigation, including sustainable development. This is a challenge for managing so-called planetary health, or One Health, where we are not just worrying about health, but we are worrying about climate change, human health, sustainable development, disaster risk and disaster risk reduction, and so on. Okay, that's the idea of planetary health.